The idea of the 10,000 Families Study originated at the University of Minnesota. It essentially looks at how genetics, environmental risks, and lifestyle can cause disease. The purpose is to identify these risks and improve health for future generations. The state of Minnesota is a melting pot where various cultures and backgrounds continue to thrive and expand. However, within that growth comes the need to address environmental concerns and their impact on Minnesotans.
So we're looking at factors that both protect health and lead to increased risk of disease.
Jen Pointer is a professor in the Department of Pediatrics at the University of Minnesota and one of the principal investigators overseeing the day-to-day operations of the study.
So most health studies like this have really just focused on individuals and not included family members, so that's one unique piece. And then we also are trying to capture populations who typically aren't included in these types of research studies.
Among them are new refugees and immigrant families.
We have big populations like Hispanics, Somalis, Hmong, urban Native Americans. So we are trying to represent all those populations in our study.
Clement Wilcox is the Community Engagement Director. She says it's crucial to continue reaching out to these communities.
These populations are underrepresented in normal studies, so we want to overrepresent them in these studies so they get the benefits, because we don't understand them. We don't know how they live, what they do, what they are exposed to, so they are at a higher risk.
A higher risk of being exposed to certain environments that could be connected to blood cancers like leukemia and lymphoma. The study was funded in part by a $12 million grant provided by the National Cancer Institute, which is looking to focus on 3 key areas. These key areas of environmental exposure are radon, pesticides, and PFAS, known as forever chemicals. And these exposures will now be captured with the new innovative method.
This is a silicone wristband that is pre-cleaned in a lab. We give it to every member of the family, no matter the age. They wear it for 7 consecutive days. This will pick up all the chemicals they are exposed to.
To be considered an eligible family, at least 2 family members are required to participate. One of them must be an adult who lives in Minnesota.
And the second step is to fill out a health questionnaire. So we just collect information from where they have lived and some health information. They consent to participate in the study, and consent that we look at the medical records because we need to compare this. And then finally, we ask them to come to a health visit.
During the health visit, the families provide several samples that are then carefully analyzed at the Advanced Research and Diagnostic Laboratory. Once this process is complete, the participants provide periodic check-ins every 2 to 5 years. It's a team effort, says Pointer, an effort supported by skilled researchers as well as staff and volunteers from the Schools of Public Health and Medicine.
And then we also have been supported by the Eagles Telethon in Rochester through their fundraising for cancer the last few years. They've also supported us.
The 10,000 Families Study will follow these families' health well into the future.
I think it is important for families to understand that even though they don't have immediate results, they need to participate in order to understand how this environmental risk are affecting us and to protect their future generations.
I think it's really important to think about future generations of Minnesotans, and the work that we do now can really benefit them, and it would be their future generations of their family who would be benefited by participating in this study.
The family unit can also include members who live in the neighboring states of Iowa, North and South Dakota, and Wisconsin. For more information on the study, you can check out the story at kttc.com. There you can also find a link to sign up and participate if you choose to. In studio, Karina Coronel, KTTC News.